Welcome to Getting Started on Your Pre-Health Track Clinical and Volunteer Hours. Today, we'll be talking about specific guidelines for clinical and volunteer hours related to the pathways of physician assistant, physical therapy, occupational therapy, and nursing. The first thing to consider is the definition and how we define clinical hours. So I like to think about this as like a rectangle and a square. Healthcare experience is our rectangle, right? It's going to be any type of work, paid or unpaid, direct or indirect patient care that you do in a health or health related field, right? So this could be delivering food, it could be ambulating patients, it could be drawing blood, it could be shadowing a doctor, right? Basically anything that you are doing that is related to patient care. Now, our square in this metaphor is patient care, right? All patient care is healthcare experience. Not all healthcare experience is patient care experience. Because in order to be considered patient care experience or PCE, this has to be direct provision of care. Typically, this is in, paid roles where you are providing a direct healthcare service to a patient. So some examples of this, these patient care experience roles would be a certified nursing assistant, a CNA, a medical assistant, emergency medical technician, or an emergency room technician, phlebotomist. These are all pretty solidly patient care experience roles. Something to be aware of here, if we're looking specifically at PCE, medical assisting, does need to be back office medical assisting. Anything done front of office, like insurance claims, checking in patients, anything like that, will count for healthcare experience, but not patient care experience. Similarly to EMT, certain programs are getting a little bit more restrictive on, what counts as healthcare experience versus PCE, right? Being, if you're directly providing care to a patient versus, just kind of generally time spent in transport. Now, other things that sometimes count as patient care experience, sometimes certain programs won't, is medical scribing, ABA therapy, pharmacy technician, and certain volunteer programs. Like I said, all of this is still healthcare experience, which is, valid and desired amongst all pre-health programs. But if we're looking specifically at PCE roles, the guide is really, are you directly providing a service to a patient? Now, looking at how these get broken down by program, our physician assistant programs are kind of the most specific about how to get those hours, what those hours have to be, and how many you need to have. Typically, most programs fall around requiring 2,000 patient care experience hours. Some are lower, some are higher, but considering most applicants have, between 4,000 and 5,000, right? That 2,000 kind of minimum is a good place to assess whether or not you're ready to apply. They also typically encourage you to have general healthcare experience like volunteering or shadowing. It is very hard to shadow PAs, and so any amount of shadowing you get is great. I usually tell students not to focus on trying to get shadowing, regardless of your track. Don't focus on getting shadowing as your first thing. It's really hard to, unless you already have a connection, to just kind of cold call someone and, get into an office or something like that. It's a lot easier if you, go the track of volunteering or working at an institution first, making connections, and then, building those connections into an opportunity to shadow directly. For physical therapy, again, this is general healthcare experience is okay. And what we mean by this is like any experience, right? Even if it's not specifically with a physical therapist, right? Is still good experience. But generally, we will be looking at a minimum of 200 hours in a physical therapy clinical setting. And here they really want to see a minimum of two different settings. Most students do inpatient and outpatient, which would be acute and inacute care. However, there are some more specialized, treatment settings like neurological rehab, wound management, geriatric care. But it's just that inpatient and outpatient tend to be the most common. So that's usually where we see students doing their hours. For occupational therapists, again, general healthcare experience is totally fine, but most programs have a really specific amount of hours that they require direct observation by a licensed OT. These typically fall between like 50 to 100 hours, so make sure you're checking with your program. But again, even if you're working in a clinic or volunteering in a clinic where there are physical therapists, athletic trainers, right? Um, and you're getting some hours with them, that will still count towards general health care experience and is valuable to have. We just also need that direct OT observation. And last but not least, for our students who are interested in nursing programs, ABSN or entry-level masters, most of these programs don't explicitly state, a required number of clinical hours. However, coming in with no clinical hours whatsoever is not going to make you a highly competitive applicant. Work as a CNA or a phlebotomist, again, where you're providing direct clinical care is strongly recommended and, highly regarded. But, at a very minimum, I would say like volunteering in a clinical space, right? Having a demonstrated engagement with the clinical field is going to make you a more competitive applicant. So in terms of how to secure these clinical hours, volunteer programs are a great way to do this. Most local hospitals and community care centers have, volunteer programs. If you go to their websites, you can apply or sign up for them. Um, Another really great program in this area, especially, is the COPE Health Scholars Program. This allows students 30 hours of very rigorous specific training, and then an additional 250 hours at minimum rotating through a hospital and each of its departments. So you get a really good observation of like what the different, departments do, how they're run, right? And just generally a good exposure to the clinical space. Also, as I mentioned, a lot of these PCE hours require certification. For our EMT programs, going to emstraining.emsa.california.gov is going to allow you to filter by county, that have, basic training, refresher training, et cetera. So that's a good resource there. I usually recommend looking at your local community colleges as well. This is going to be, a very affordable option, and also they are very reliably accredited. So this is where I usually say go here first and see, what programs your local community colleges have. And last but not least, you can also look at the California Department of Public Health. They do have lists of all accredited certification programs. So these are good resources to look up some of those certification programs you might want to engage with. Also, the University Career Center is a great space to look for, on the job board for any jobs that might be posted, as well as attending networking events with health professionals to begin to establish those pathways. And always, always, always looking to expand your network, right? And thinking really broadly about what your network is. Using LinkedIn, Fullerton's LinkedIn page to connect with alumni, right? You can filter the alumni tab by what major they had, what they're doing right now, where they work, right? So connecting with people who are working in professions you're interested in, or even going to school, right? Currently in like a PA program. And just, not outright asking to shadow or do anything like that, but more saying, hey, I'm also a Titan that's on this track. I'm just wondering how you navigated it. If there's anything you can share with me you found particularly helpful, right? Ask them for like, 20 to 30 minutes of their time. And sometimes that can lead into, opportunities to gain additional clinical hours. But at a very minimum, it's going to give you a little bit more idea of how someone, in your shoes kind of went about it and successfully navigated that pathway. Also thinking about joining on-campus clubs, right? We have lots of pre-health clubs on campus. Always, always, always talking to faculty, particularly if you're interested in research. And I always say, don't forget about family and friends, right? We're going into the holidays, right? This workshop, I'm doing this in November. So we're about to go into the holidays. And, I know a lot of family tends to say, what are you doing? How's school going? What are you, what's next for you? And it can be really tempting to roll our eyes. But, being honest and open, like, hey, I'm actually looking to get clinical hours for, this specific track, right? I always say, you never know if Aunt Sharon's coworker's son is working as a physical therapy assistant somewhere, right? It might be able to connect you with someone. So, don't forget that you've got like 4 degrees of separation that you can, sometimes tap into just by, having an open and honest conversation with family or friends. Last but not least, right, in addition to academic requirements, which I cover in another workshop, clinical requirements that we were just talking about, there's also thinking through your extracurricular activities. And this can be anything from completing research to starting your own business to, part-time work that you have, to, intramural soccer. Um, but what it should do is it should demonstrate your values, your passions, and your skills outside of the clinical and academic realms, and demonstrate things like leadership, teamwork, collaboration, right? Research, right? If this is something you're interested in, for these pathways, I wouldn't say it's like strongly recommended, but if you're interested in research, being in an undergraduate academic institution is a great place to get involved. Most departments have some kind of research. The best way to find that is to look at faculty profiles, look at the research they're doing, and reach out directly. Also, talk to your faculty and courses you take. If you do get started on that research path and you want to continue on, our undergraduate research center, UROC, is a great resource there. If you are part of a program like honors, or even part of a major that allows you to do like a thesis or a capstone project, use that for that research, right? Kind of make it your own. Research something that you uniquely are interested in. And last but not least, summer research programs, both here on campus, but also a lot of summer research programs at other campuses are open broadly to students from outside of that specific campus. Um, so if you're not, maybe from around here, you come down here, you go back home for the summer or something like that, and there's another local college there, right? Looking at their research programs over the summer and seeing if they're open to, non-students. Also joining student organizations and clubs. So, we have physician assistants coming together, the Student Health Professions Association, but we have plenty of other pre-health clubs you can join. But not all these have to be pre-health, right? You can join college student leadership. You can also join, special interest groups on campus, cultural clubs, et cetera. Again, your involvement in these extracurriculars should be driven by what genuinely interests you, right? If you get involved in research because you think that's what a school wants to see and you spend years and years doing it and you hate research, when an admissions committee looks at your application, they're going to think you love research. And that's a shame, right? That you're telling them something that you don't actually like. So always, always, always remember that these activities should be dictated by what motivates you, what inspires you, and not what you think you need to check off, right? Volunteering is also really important for most of these pathways. If you're already working with or you have previously worked with like a community group or something like that, I would say look at ways to take on additional leadership, plan an event, coordinate a group meetup, something like that. Idealist.org is a really great resource for identifying nonprofits and NGOs working in interest areas you might have in your area that are looking for volunteers. So that's a great resource. Also, again, looking at community groups or faith groups you might be a part of, and looking to kind of take on leadership in, fostering community within those spaces. Also, just general work, right? I always say, working at like the habit, right? That's working under, pressure. That's communication, right? And communicating with, difficult customers or colleagues sometimes. If you, train or onboard employees, then that's, leadership right there. So, don't negate the work that you do. And, finally, hobbies. Some of the most compelling applications I've read in the past few years have been through the lens of a student's hobby that is, otherwise unconnected to the clinical realm, but they look through it and describe, what it is about that hobby that they love, right? That fulfills their passion, that sets their worldview, and how those things are connected to their desire to pursue a health profession. The more you can connect, you know, each piece of yourself through a common narrative, through a common thread, and use it to support why, your specific health profession, right? Why PA and not PT? Why PA and not medicine, right? That is what's going to give you, the strongest application. So again, make sure that you're looking at yourself holistically, because the committee certainly will, right? Your admissions committee certainly will. That is all for today. If you have any, questions or more information about academic prerequisites or the application timeline, and considerations, you can find workshops on those, the same place that you found this workshop. And thank you for attending today.